Welcome to the Staying Active podcast.
All right, welcome back. We did it. We're back. John, it's good to see you, as always. Today we're going to talk a little bit about VO2 max because nobody knows what that is. It's cool. It's fun. It sounds exciting. It screams performance. But especially for our shared clientele, patients and clients, most of the time when people hear about like VO2 maxes, it's usually around the Olympics or the Tour de France, and it has to do with somebody doing something really difficult, endurance wise. So right. I figured maybe a good start is we can just start with, what is VO2 max and why do people such as yourself, why do you guys keep talking about how important it is for health? Why do I care?
Yeah, so great question, and it's good to see you too. It's good to be back on the podcast wagon. This is awesome. So yeah, VO2 max, it's got a cool name to it, and like you said, like the existence of a VO2 max implies that there's also like a VO2 min and like a VO2 average or something. Like it's like max, like the coolest ever. But basically what it is it's a measure of your body's horsepower. So it's a test, an exercise test where we measure how much oxygen somebody can use for aerobic respiration, meaning using their oxygen to create ATP or the energy of the cell, as opposed to just like lactate, like you do with like short bursts of energy. Mm-hmm. So it's how much oxygen you can use to create energy at maximum. So V stands for volume. It's like the amount. O2 is oxygen. So the amount of oxygen, and max is maximum. Amount of oxygen you can use at maximum. And so when we talk about, the Olympics, for instance, you had this Norwegian cross-country skier. I mean, they're all fantastic, but the guy who won like 5 gold medals, he's sprinting uphill at 11 miles an hour on like mile 26 or something nuts.
Absurd.
Like his VO2 max, they say is somewhere between like 80 and 90 is kind of the estimate. The highest ever measured is somewhere around 100, but we compare people when we do the test. We compare people to other people of their same sex. So we compare men to men and women to women in the same age range. So typically it's like a 10-year age range. Like people in their 20s, we compare to other people in their 20s, in their 40s, in their 60s, etc. The reason why this is important is because VO2 max is the best thing we have to predict how long you'll live. It is, in fact, a more powerful predictor of mortality and predictor, therefore, of longevity than even smoking. And so usually we'll break people into like kind of 5 categories. There's like super low, below average, above average, high, and elite. Elite being kind of like the 98th percentile and above. And if you are in the elite category versus the low category, you have a 500% lower risk of death. We call that a hazard ratio of 5. To put that into context, smoking, it has a hazard ratio of 1.3 over the lifetime. So even if you compare people in that like kind of like second to top group versus the below average, so you're not even comparing the extremes, you're comparing like better than average and worse than average, the hazard ratio there is 1.4. So it's even better than smoking, even if you're just comparing like people that are better than average to people that are lower than average. And it's basically 2 things. One is it just means that the more fit you are, the longer you'll live, which is probably not a huge surprise to people. But the really cool thing is that it's entirely modifiable. So you can improve your VO2 max. There's a reason why these elite athletes have high VO2 maxes. It's not because they're born that way. It's because they train that way. And so it's something people can change. It's a modifiable risk factor for longevity. We can directly measure it in the office, in the gym. And so I'm super passionate about this, and the data are, we don't get a lot of things in medicine that like where the data effect size is so powerful, but VO2 max is one of them. And that's why I am giddy for VO2 max. I love it.
I could not tell, so it's good to know that you're so interested and that this is such a good topic for you. So with that, That's a lot of information. And so
Yes.
I think worth clarifying is just like a couple of definitions for people. So
Yes.
we're talking about like energy, ATP, and lactate. Can you
Yes.
just give a couple of quick, what's the quick and dirty on what are those things?
Exactly. So when humans, and really all animals, but let's talk about humans. When humans need to do things and move, and their cells need to do things like move your body and digest and think, you create energy called ATP, and it stands for adenosine triphosphate. That doesn't really matter, but it's the energy source of your cells. And there's two ways that we can make that. One is that we don't use any oxygen to make energy, and that's through the lactate pathway. And that's pretty inefficient. You only get a few ATP per unit of energy put in, basically. Whereas if you use oxygen, you're a lot more efficient. You get a lot more ATP bang for your buck, so to speak. And it goes through the mitochondria. If you've like, everyone kind of knows the meme, the mitochondria is the powerhouse of the cell, right? Like, it's
There you
very
go.
true. That's the mitochondria uses the oxygen down the electron transport chain, if anyone remembers from biology. And so if you use oxygen to kind of create ATP, to create energy in the cell, it's a lot more efficient to use it that way than to use no oxygen. But you do have both pathways. And so we're measuring here more your ability to use the oxygen to create energy. And higher trained athletes are able to use more oxygen to create more energy. And therefore, the horsepower energy is kind of the best, and horsepower analogy, rather, is sort of the best analogy that I can come up with, that people might be familiar with.
That's perfect. So I guess more directly, just when it comes to, I want to call it definitions, but it's probably just like baseline understanding. Somebody, they do the things, they put in the effort, they improve their VO2 max. Right out of the gate, what actually changes about their body, about their life? Like, what do they like tangibly get back? Because the data is cool, but most people don't see, and in some cases they're just like, okay, what does that even mean? The data doesn't matter to me, other than like you say it's cool. What happens to this person?
Yeah, so the person who say they've trained, or and they have a pretty high VO2 max, they've improved their VO2 max. What improves is, in one word, your fitness. And what that means is it's your ability to perform like motion, to ability to do things like, for instance, if we take a standard like mile run, for instance, presumably your time in the mile run will be faster. Presumably you will be more efficient at using the oxygen to create energy for yourself. You will have a higher output for a given level of input, and so it is essentially your fitness improves. And so you're able to do more from the standpoint of like maybe even lifting more weight, but typically it's kind of more from a cardiovascular standpoint. So you're faster on a bike, or on a timed row, or on a cross country skiing course, or running, or walking, or rucking, or hiking, something like that. And you basically you get better at those types of things. It's not necessarily the same thing as efficiency, but it's very closely related. So you can think of it sort
Mm-hmm.
of that way if you want. But people often notice their performance improves considerably if they're training for to have a better VO2 max.
That makes sense. So it kind of reminds me of our discussion about statins and the liver, how, what they do is they actually affect the liver's performance, not necessarily just the cholesterol, right? In this particular instance, we're talking about how improving your VO2 max doesn't necessarily make you faster, but it makes you better at utilizing oxygen, which inherently makes you faster.
Yeah, exactly. It's like, you can probably have the same VO2 max and like, run a 100-meter sprint a little bit quicker, but that they're not necessarily the same thing, but again,
Mm-hmm.
very closely related. Typically, if people are training and improving their VO2 max in a considerable way,
Yeah.
yes, they're getting faster in a certain domain
It's
that they're
kind of a
training.
rising tides sort of situation.
Yeah, exactly. Right.
Yeah.
All boats rise. That I'm gonna shut up. I don't know the.
You're
I
doing
don't know
great.
the saying.
You're doing great.
I know the saying. I can't explicitly pull it out
I'll
of my
stick
head
to
right now.
I'll stick to nonsense quips. You stick to being professional and smart. Everybody's got to know their role here, and I'm the sassy one, right? So, just trying to get to some of like other modalities that people understand and trying to steer this away from the like people think about VO2 max, they hear the terminology, it's complex, sometimes it can be confusing. They think they think about athletics and things like that, but I want to kind of steer it back towards the longevity aspect and the health span aspect. So, trying to get away from some of the performance, I want to focus on like the overall measure of health span and longevity. Is VO2 max testing, is that data better than that of like someone's overall weight for their age or their body fat for their age? And like
Good question.
what's the situation with that?
Good question. So right, so there are many things that impact somebody's longevity and health span:
Mm-hmm.
muscle mass, fat mass, their diet, their sleep, their stress, hereditary things. But VO2 max, as far as what we've studied, VO2 max is the best thing, the best predictor for longevity that we have. So it is not just it's not just something that athletes do to track their performance. It is something that really everyone who's interested in living a longer and healthier life should be training for to improve. And it's not that having a high VO2 max itself makes you live longer or healthier. It's mainly that the VO2 max is a marker of how fit you are, and that's the piece that makes you live longer and healthier. But again, there's specific ways to train for this that that increase your VO2 max, and we've seen studies where people who are in their 70s and 80s improve their VO2 max with training. So it's never too late to improve it. And if you say you had a really high VO2 max when you were in your 30s, but you don't do anything for 20 years, yeah, you had a benefit back then, but if you're kind of back down into the below average category now, you're in the below average risk. So, which is a higher risk. But you're absolutely right that there are other things that impact longevity, but the association between VO2 max and longevity is the strongest one that we have yet found across the board.
So the way that I'm understanding this is it's not necessarily that the measurement of your VO2, right? Like the positive outcome. That's more like trying to quantify what is considered to be good fitness across populations. That's
Yes.
okay.
Yes.
And so the argument is fit populations live longer and better.
Yeah, and that probably surprises nobody, but it's the extent of the data, and the actual, like, these hazard ratios are literally astronomical. And that's the really cool part about this is like, yes, we knew this. Like your grandma could have told you, like, yeah, if you're fit, you'll be healthier. Okay, they're almost synonymous, right? But it's like it's actually considerably healthier.
Well,
it is significant.
When you dig into it, I mean, it makes total sense, right? I think that this is exciting because it's almost a euphemism, right? Saying, oh, fit people, live longer, they're healthier. Like, what does that even mean? Like, what does fit mean? Because there are so many different things you can do and be proficient in, and then have somebody consider you to be fit, right? Without having a catch-all that encompasses the totality of fitness as far as measurements are concerned, we don't actually have anything definitive. So this is quite exciting. It does put a weird pressure on people to consider cardiovascular fitness and cardiovascular modalities within their fitness. And so we've talked about this before, but does that put a hard position on people who are like strength training addicts like myself?
No, it's more the case that we just don't have as good of a way to measure how someone's strength correlates to longevity simply because there's a million and one ways to measure strength. I think actually the thing that's been studied most is grip strength.
Yeah.
And that has shown, higher grip strength is a marker for longevity, not as much as VO2 max. But it could be the case that if we, and this study has never been done, but if we combine someone's VO2 max with their grip strength, that has a hazard ratio of 20 or something, right? It's like even better. And so the studies need to be done to kind of combine the two, and it is absolutely the case that both are very, very important. We know that, and as we've talked about in prior episodes, strength training is absolutely critical for metabolism and skeletal health and fall risk prevention and balance and functionality as you live longer and a million and one other things. But if we're talking about like what is the best marker we have just for objective, apples to apples comparisons between people in different populations and age groups, VO2 max takes the cake. But it is not. That's not to say we need to avoid weight training, weightlifting, resistance training. That's certainly still very, very important.
Yeah, so you're not advocating for upending, anybody's system of like strength and conditioning, right? You're simply saying that the data currently is there, and if you want to know for sure that you kind of fall into this more optimistic categorization, then increasing your VO2 max is one of the ways that we can say pretty handedly, like, yeah, that's going to work out for you.
100%, absolutely.
Yeah. So that's great. I mean, it's not a full pivot. It's more of a keep doing what you're doing. There are obvious benefits to things that are not like cardio conditioning related, but you should be adding this in, especially if you want to know, what does the current science say and what's our the current technology as far as measuring those things. That's great.
Absolutely.
So it's fair to say then that that somebody who appears to be fit can have a pretty poor VO2 max. Then I would assume.
Yeah, sometimes you're surprised, or I'm surprised. I do these tests fairly frequently for my patients, and I'm the one who runs the test, or at least have been thus far. And sometimes you get surprised. Sometimes there's patients who you're like, oh, this person's, I don't think they're going to do that well, and then they come out with a great result. And some people are like, oh, they seem like phenotypically they look really fit. I would say that sometimes you get fooled and they're like below average. And so it's not something where you can look in the mirror and tell, okay, here's my VO2 max.
Yeah. You
absolutely have to do the test. The test is the gold standard. It actually directly measures your oxygen utilization. Now there are wearables that will guess at your VO2 max. And so the Apple Watch does it, the Whoop band does it, the Oura Ring does it, the Hume band does it, just to name a few. And these are typically fairly accurate. However, they're using surrogate markers as a guesstimate for your VO2 max. And so, like from personal experience, my VO2 max on the Whoop is 3 points off, which is not that bad compared to my actual VO2 max test. But I've had patients who've been off by 10, which is pretty significant and can change.
That's huge.
You can be across 2 quintiles essentially. And so it is useful data, but it is if you really want to know for sure, you've got to go through with the test.
Can you define that? You said quintiles?
Yeah, the quintiles are just the like the groups that you're in based on what number you are. So like the groups of, it's basically 5 groups: the low, below average, above average, high, and elite. So those are the 5 quintiles. Great. And so you could go from like above average on your compared to your like Whoop data, and then we actually do it and you're below average. So that makes a huge difference in terms of your risk, your longevity risk, your hazard ratio. And so it's just to make sure that if you're interested in this, you're actually doing the true gold standard VO2 max test.
Yeah. Let me ask you this. So VO2 max testing is I wouldn't call it inherently easy. You're trying to find your threshold in as a matter of kind of like speaking, right? What are some of the reasons why people perform poorly on these sorts of tests. One of them, in my experience, I've taken a couple of these, and I've observed several, and even proctored a couple of them. It seems like a lot of people psychologically give up well before their bodies ever do.
Yeah.
What do you think about like all that? What seems to happen with people?
Yeah, so that maybe we should talk about a little bit like how the test is done, because I think that'll kind of
That's great, yeah.
illustrate why that's the case. Because you're absolutely right. It is, if you give a crummy effort, you'll get a crummy result.
Sure.
But in max, implies we want people to give their max effort. But how this is done is that we put people on either a treadmill or a bike, because those are the two kind of ways that have standard protocols. We use a bike just because it's more accessible to people than a treadmill. And you can just give up just by stopping. You don't have to like hop off the treadmill. It's a little bit safer. But basically, after at least a 5-minute warm up, we increase the intensity every 2 minutes. And so we get this kind of like, intensity goes up, stays stable for a while. Intensity goes up, stays stable for a while. Intensity goes up, stays stable for a while. And that's called a graded exercise test, or GXT. And this is the gold standard of how basically the population data was performed. And so this allows us to make an apples to apples comparison between our patient or client and the data that is published. And so it's a little bit diabolical in that sense because there are no breaks. So if people typically are doing some sort of interval training or something like that, you're taking periodic breaks. Even if you're doing like Tabata, 2-to-1 effort to recovery ratio, you're still getting some break. With this, there is no break. We just, after 2 minutes, okay, let's up the intensity. Another 2 minutes pass, okay, let's up the intensity. And we keep going, and we keep going, and we keep going. And we don't tell the patient or client when it's over. They tell us when it's over. They're like, listen, I can't give any more. But often, like you said, that's probably like 95%. Usually there's like a little bit more left in the tank, and people just don't want to suffer through that last little 5%, because that's the worst 5%. But that is really where the money is, in terms of like, bumping a VO2 max to like 5, 6, 7, 10 points in that last little bit. And so I try to coach people when I'm running it, like, listen, I'm going to tell it, like, when you're telling me you're done, I'm going to try and push you for at least another 30 seconds to give a little bit more, completely empty the tank to where you just are gassed and you can't go anymore. And that is the sign of a reliable test. Sure. It's obviously difficult in that sense. And that's where, having people who can coach you really well come in handy. And I think our trainers do a really good job of that. But there's a little bit of a mental hurdle to get over, because it's easy to just throw in the towel and be like, nope, I've reached my limit, I'm done. But oftentimes there's a little bit more people have in the tank that we try to, squeeze the towel, wring the towel a little bit more to get that last little drop out of people. And then we get the VO2 max data, on the machine, and hopefully they're in a good quintile. So
with this, right, we're kind of talking about the stress of the test itself, right? It's a weird training environment, because any other situation you would likely want some sort of break, unless of course you were doing something competitive, running a race, doing something like that, right? Obviously you would monitor your output so that way you could manage your energy in a way that got you to the end, right?
Right.
This is a little different because it's quite literally until you can't, right? So I guess from the perspective of a physician, how might you suggest somebody prepare for this? Not just physically, but maybe mentally, emotionally. I'm not trying to make it sound horrifying, but I see a lot of people get a little surprised by like, oh no, like this is so hard.
And it's right. I think it's in your training. I think that's kind of where it starts, is you've really got to just be comfortable, kind of like pushing through the suck, so to speak. And I had a patient who did this recently. He was like, listen, my legs were burning, but he had actually listened to or like met with at some point a Navy SEAL, and like the motto was like, it's just pain. So that he's just kept telling himself like, it's just pain. It's just pain. It's just pain, and like powered through and got a very good score. But that is something that some people, even if they're training fairly intensely, they never reach that level of really kind of maximal exertion because it's a very uncomfortable place to be. And so when people are kind of preparing for this, in addition to some of the protocols we tell them about, not working out hard beforehand and, not having anything significant to eat, a few hours beforehand and caffeine and things like that, again, just to standardize the test. We try to warn them like, hey, listen, this is something like you tell us when you're going to stop, and I'm going to try and push you past even that point. So that like when you're stopping, it's really because you can't go anymore. But I think people need to be okay. Like, again, they're supervised. There's a trainer right there if they really just need to stop. Again, that's why on a bike it's a little bit nicer because you can just stop biking and you're still just sitting there on the seat.
Yeah.
But it is, I don't know how you coach people through that because you're doing that probably more frequently than I am, like even in training environments, because you don't want to make it so daunting that it's like this big behemoth on the horizon, like, oh no, this is going to stink so bad and it's going to be painful. And like, yeah, it's not fun, but it's everyone that has been done it, that's at least thus far, has been glad that they have.
Yeah.
So yeah, I don't, that's sort of my philosophy. I'm sure you have a better way about it, but
No, I mean, so I'm a huge fan of like micro goal setting, and that can go all the way up to, a 12 month, a year long, worth of goals, right? All the way down to a couple of minutes, right? I think what you said about the Navy SEAL, I think really resonates with me because that's my philosophy on something. It's like if you want something, well then you have to rise to whatever the level minimum level is to achieve that thing. And if it means that, hey, this is going to be tough, this is going to be rough for a little while, it's a little bit of pain, it's discomfort, it's more than you thought you could do, well, that's just information. And if you know that going into it, then just setting your sights on micro goals is appropriate. And so we raise the difficulty every 2 minutes, right? And so for me, when I'm going through these tests with anybody, I like to talk them through that. Information and context are really, really powerful because you have complete agency over yourself. You can stop this test anytime, right? But it's only 2 minutes. And you're already 30 seconds in. We've just been talking about it. Here's where you're at. This is what the machine is telling me your VO2 is right now. Can you go another minute? Can you sustain this level of intensity? It's just another minute. And if you can, then we'll try a little bit harder, but it's only 2 minutes. Mm-hmm. And you're already 30 seconds in. And it's just breaking it up into these little chunks. And if you know what's going to come next, and you can give up any time, I think what's harder is not knowing. What's harder is I'm just going to have to do this in perpetuity, and I'm just suffering, and I'm always going to be suffering, right? That, I think, is way worse for people to live in that environment than to just keep feeding them. Because in most cases, you're right, they haven't pushed themselves this hard, and they otherwise would not. This is a competitive environment. You're competing with this machine to force it to tell you you're healthy, right? Exactly. You are trying to make it. And I think that sort of strategy really, really helps people. But that's just what I've noticed. It's like, look, yeah, you're right. It's only pain, and you only got to do it for 30 more seconds. You can stop anytime, but you know what? Here you are. You want 55? You want 100? Let's go, Right. Psychos. So I guess the thoughts that come to mind for this are, like, obviously this isn't just for athletes, right? It's cool for athletes, but like, if they're athletes, they kind of know they're fit to some degree, right? So I guess kind of bluntly, who should be testing their VO2 max?
My strong opinion is everybody who can do the test, I think should be doing it. Again, anytime we order any test or do any test, the question, at least in my mind, the biggest question is, how does this change management? And what are we going to do with
Very good question.
So with a VO2 max, the information is not just nice to know, it is actionable. And we give you a number, we say, okay, you're in the the high category, the high quintile. What do we need to do to get you to the elite quintile? Say you're in the elite. How do we keep that in the elite category as you live longer? Because VO2 max does decrease with age, but again, it's age matched with your colleagues. If you're in the below category, how do we get you to the above average category? So it is completely actionable, and they've shown that in several studies that people of any age can improve their VO2 max with even pretty light training. And the good news is that the more untrained you are, the less it takes to really make a big difference in your VO2 max.
Crazy.
And so it doesn't take a ton for people to get out of the low or below average categories. It takes quite a bit, and it's really tough to get from the high to the elite category. But anytime we're making progress, and even if we're staying in the same quintile, but the number has gone up, that is a win. That is absolutely a win. And so I recommend anyone who is able to comfortably sit on a bike and exert themselves without risk of, a heart attack, or without significant orthopedic discomfort, or without balance issues, or without significant claustrophobia where you can't wear the mask, because we have people wear a mask that captures their breathing, and it's not that uncomfortable. It's actually pretty reasonable to work out with it. But some people just don't tolerate it. But as long as you've met those criteria, I am very much in favor of it. And I've done it in people in their 80s, and I've done it in people in their 20s. So, and everyone in between. So it's something that I like all my patients to do. And some people do it. They're like, I've done it once, and I'm like, I don't want to do that again. And that's okay, right? We get a number, and it's not mandatory by any stretch. Yeah. But it absolutely makes a big difference for people to know where they are.
That's good to know. So you've mentioned the data being actionable a couple of times, and I think what is probably appropriate for people who would be interested in a topic like this is, what does that action look like? Say it's, good, middle, bad, what sort of action are we taking given any result?
Yeah, so that's a really good question. As before I kind of answer that, I think it would be useful to just define a little bit of what the test output gives you, which
Great.
is your heart rate zones, because that incorporates the training that we recommend for people. And so if people do this VO2 max test, it'll give you what's called your heart rate training zones. And there's 5 zones, zone 1, 2, 3, 4, and 5. And they correlate to your higher heart rate is a higher zone. And it basically correlates to what level of exertion you have at, and what heart rate you're at for different levels of exertion, basically. So level 1 is, like very easy, like light walking. Zone 2 is kind of like if you were on a phone call with someone and you were doing zone 2, they'd be like, Derek, are you exercising right now? But like you can still talk and do all that stuff. Zone 3 is a little bit more intense than that. That is like where it's kind of like a little bit tougher to have complete sentences, but you can keep that for a while. Zone 4 and 5 in particular is like kind of like your max heart rate zone. Like it's something you can only sustain typically for about a minute or so. And those are will give you specifically your heart rate zones in the test. And so when we talk about training to improve VO2 max, if you are in the low, like the lowest quintile or the below average quintiles, let's say you're like not doing so great, you can get away with just zone 2 training for, prolonged amounts of time, like an hour of zone 2, 2 or 3 times a week. That is enough to improve your VO2 max fairly significantly. And so you don't have to be going all out, is the point there, to improve your VO2 max. However, if you're a trained individual who is, fairly athletic, and you're already in the above average or high or elite category, you really need to be doing some sort of high intensity interval training. You really need to be getting into that zone 4 and zone 5 for as long as you can during the week, because the more you push yourself into those zone 4 and zone 5, that's really where the bang for your buck comes in terms of VO2 max improvement. And so what we recommend for people typically is somewhere between 30 minutes to an hour of zone 4 to 5 per week, kind of at a minimum. And what that looks like is typically somewhere between like, 60 to maybe 120 minutes of high intensity interval training or Tabata work, something like that, throughout the week. It typically doesn't mean you're just at zone 5 for like 20 minutes straight, because that would be diabolical and probably not sustainable by definition. But high intensity interval, like interval training, high intensity interval training. So like, doing sprints on a bike or sprints when you're running, or like super high resistance on an elliptical machine, or, jogging uphill if you're hiking for a minute. You're kind of just gassing yourself. Really makes that the biggest difference there. For all active health clients, we give them what we call our VO2 max improvement guide after they do the VO2 max test, which has specific kind of guidelines and exercises in that, how many minutes per week, what the sample breakdown of that looks like. But there are many ways to do it, but essentially you need to be reaching the zone 4 and zone 5, especially if you're already in the above average, high, or elite categories, to improve your VO2 max.
Very cool. So I guess we can kind of start wrapping this up a little bit and start giving people some takeaways, unless you think I missed anything along the way here.
No, I don't think there's much other than the test typically takes, for people who are curious, typically takes 20 minutes or less, for people kind of from start to finish. For most people, I think the average is probably like 18 minutes or so. And we can adjust to the level of, if you're not someone who cycles a lot, we can kind of ramp up the intensity a little bit more slowly. We have different protocols for that, and most places that do this do as well.
Mm-hmm.
But I would encourage anyone to do it. I think, again, I've done it myself. I know you've done it yourself. And for those of you listening, the first time that we both did it, Derek beat me by a point. Not that that's a,
who's counting?
Not that anyone's counting, but it's tattooed onto my arm as like a Rocky, moment, and just keep training in the dark, like just, cursing you. But I'll beat you one day. But something definitely everyone should be doing, and again, something I'm really passionate about.
Yeah, that much is clear. That was a lot of really, really great information, John. So I genuinely appreciate it. And for my end, just closing on this, it's a really simple thing, right? It's a 20-minute test. If it's available to you, it is data that is the most sophisticated for monitoring fitness as it pertains to health span that we have to date anywhere in the world. Like I said, it's too easy. And if that's something that you're interested in, this is the best of the best. So it's something that I think everyone should do. And, without having, the physician perspective, I will say that a test like this does a lot for you in terms of like what is necessary for like sensory information. If you have not pushed yourself in this sort of testing, you do not know what it means to push yourself to make a difference. You don't know how hard you have to push in order to make that change. Right. And if you're afraid of that, that's fine, but don't be afraid of it without any information. That's just fear for the sake of fear. That's gaps in information. Go find out what is required and then ask yourself, could I do slightly less than that, but for a longer period of time? And if the answer is yes, then you can improve and you can get better and you can see the benefits of increasing your VO2 max. And that's where I'll leave it. It's too easy to learn something about yourself in this way. And if you're a patient of the practice, this is something that is offered to you for no charge. So please take advantage. Otherwise, that's what I got. This has been, staying active with Dr. John. Wow, what a guy. And me, Derek. And so VO2 maxing, it's good stuff. All right. Yeah. Thanks,
all
everybody.
The kids are doing the looks maxing. We're doing the VO2 maxing.
That's right.
I think it's better. So
it's way better. We're cool now. Bye, everyone.